Thank you. Ladies and gentlemen, again, the purpose of this is to keep our people informed of what we know and what we think and why we're doing what we're doing. And I want to apologize for coming out a little late, but we had a video conference with the President and the Vice President and other officials in Washington, in the White House, and most of the governors, I think, were on the line. I think of 54 out of 55, counting the territories. And the good news that is coming, and we're hearing more and more, is we can tell around the country the feeling is that the end is in sight, that the mission is going as well as can be expected. There's still a lot of work to do. We cannot let up, but the end is in sight, and we're making progress. A few things to tell you before we bring up some others. I've today proposed a solution to the General Assembly. As you know, they left last week without passing a continuing resolution to keep that is the budget and the money that is going to be spent starting on July the 1st. And we don't want the government to close down, but it's difficult for them all to come back to the State House before May the 14th, which is the normal date that the General Assembly would adjourn, because that is probably when we will be at our peak here in South Carolina. So what I proposed to them was that they need not return, that I will call them back in June, and by June, particularly by the fiscal year starts on July the 1st, so by the end of June, we expect our economy to be humming. We expect to be well back in business by then, and I can call them back then, and they can come in then and pass that continuing resolution and any other important matters they think, and that way the government will not shut down. We will have no concern about having the government shut down. We will not let the government shut down, and it will continue on into the next fiscal year. A few other things. I've gotten some requests, you may have read about them, about postponing our primaries on June the 9th. Well, at this point, we see no reason to do that. Again, we expect things to be moving along very well by then, so there's no reason to do that. We have current voting methods with absentee voting and those things that if we utilize those to the fullest, we ought to be in good shape. And of course, the runoffs will be on June the 23rd. And as we look around at other states, some of them have postponed their elections that were being held in May, and they are moving them back into June, about the same time as ours. So that seems to be, again, a positive sign around the country. I want to thank the hospitals for the great work that they're doing, and that includes everyone from the nurses and the assistants and the doctors to the executives and everybody concerned for the great preparation they did. As you know, we asked them to consider reducing elective surgeries as much as they could to make way for the surge and to prepare to see how we can open up beds for what we expect may happen, and they've done so very well. The surge, we think our peak will probably be, we think, in early May. So they are happily able to now, we know how to shut down, how to start back up. So they are now beginning to do more elective surgeries than they were, but we are assured that when the time comes, when and if the time comes, to the extent it comes, they will be able to handle the medical needs of the people of South Carolina. We've got a lot of ventilators, we've got a lot of critical care beds, and our medical community, the healthcare community, is as organized and functioning as well as I've ever seen it. Next week I will announce something new. We're going to call it Accelerate South Carolina. What is that? That is to accelerate, to find the best practices to get us back working at full speed and to ramp back up to where we were before the virus came along. As you know, we were announcing record numbers of job growth and all of those things. We were right at the top of our game and growing, and we want to get back there. So we're going to put together a group that will meet. It will consist of people from manufacturing, from tourism, hospitality, agribusiness, from the state agencies, from the General Assembly. You name it, it'll be there. We'll not be in silos, but be working together, keeping social distancing and doing a lot of things remotely. But we will come up with the best practices to get business humming again as quickly as possible in South Carolina. Now, it'll be measured just as we measured it carefully going into where we are now, in restricting some businesses, in restricting activities, in asking people to comply with certain things. We're going to be coming out in the same measured and careful way. To do so immediately, to do so too quickly would be reckless, and it would be, if we had a return of the spread of the virus, it'd be virtually impossible for us to turn the system around again. But I'm going to assure you that we are going to find the best ways to do it quickly and safely, and we will have return our economic revitalization and growth. We will have testing for contact tracing. We will be careful with the elderly and the vulnerable, and we want to be sure that we prevent a recurrence. Also, the CARES Act is another thing that this Accelerate South Carolina will be making plans for, and that is the money that we're receiving from the federal authorities. It's about $48 million. It'll be going to K-12 and higher ed, and then an additional $1.9 billion for the state and local governments. Now, what is that going to be used for? That is to reimburse us for the expenses that we have incurred in responding to the virus. And we are very grateful that that will be done. And we thank President Trump and his administration for that. And finally, one of our first steps in moving back towards the revitalization will be today I'm issuing an executive order. It's a small step, but it is a step, and there will be more, to open our public boat ramps back up for fishing and recreation. You know, in earlier orders, we asked people to take life a little easy, to relax, to recreate, to get out and walk, exercise. Well, a lot of that happens on the water. A lot of fishing, a lot of families like to get on the water. So we're going to open those ramps back up, but we still insist, watch your social distancing, don't have any large gatherings, do the things that we've asked you to do before, and we'll be fine. So I say again, I want to thank the people of South Carolina for what they've done, and also I want to thank the people down in Hampton County and up in Seneca and Oconee County and other counties that were hit by these tornadoes. In spite of the devastating blow that has been delivered to them, they were taking care of the workers that were coming to clean up the roads, to get the trees out of the roads and out of the houses, and they were cooking them food. The churches were working and activated their kitchens to be sure that the people working on the power lines had food to eat. In fact, I got one report that some of them were sorry they'd finished their work because they're going to have to go home and go miss a lot of that good cooking that they'd gotten used to. So, again, I want to thank the people of South Carolina, but I say again, it's too early to celebrate. We've got to keep the lid on ourselves, contain your enthusiasm, because we still have to get out of this. But we're going to get out of it, and it's going to be sooner rather than later. Thank you.
Thank you, Governor. I'm Linda Bell with the South Carolina Department of Health and Environmental Control. Good afternoon. As of today, we are reporting 276 new cases of COVID-19, which brings the total number of people who have tested positive with this disease in South Carolina to 3,931. It's important to remember that no one is removed from the risk of exposure to this disease. We don't understand about who is immune among those who have already suffered from the disease. We have a lot to learn, and there's currently no vaccine. So people in our community are getting sick and even dying still. and we're calling on everyone to stay home, but this is especially important if you have health conditions such as diabetes, heart disease, or lung disease. Locally and nationally, data show that the elderly, as well as African Americans, are disproportionately impacted by this disease. Also, although African Americans make up about 27% of the South Carolina population, they comprise 41% of COVID-19 cases for which we know race and 56% of deaths associated with COVID-19 infection. At the core of this problem is the fact that African Americans are disproportionately affected by conditions such as cardiovascular disease, diabetes, asthma, obesity, and are also disproportionately affected by access to care at times. People with those health conditions that have been listed are at higher risk of severe disease from COVID-19. And we recognize the critical need to address these inequities, and in an effort to reach the different communities who are at high risk of having severe illness from the disease, we are collaborating with our state and local partners, both public and private. And this includes working with local churches to help communicate prevention messages to better reach communities of color about the risk, delivering 100% of our women, infants, and children, or WIC, nutritional services over the phone. We're working with partners to expand options in a variety of food categories to address WIC product shortages. And we're partnering with environmental justice advocates to raise awareness and providing sneeze guards to restaurants and the Department of Motor Vehicles. While we've been working to enhance our outreach efforts, we need to do more. We are exploring new ways to reach high-risk groups, including working to form partnerships to help express how conditions such as diabetes, hypertension, asthma, and obesity exacerbate COVID-19 symptoms. DHEC is also expanding our testing capacity by deploying the Abbott rapid testing machines in pockets where testing access may be limited. We realize we're asking a lot of our residents and that it's not easy. But what we're calling on South Carolinians to do by staying home and limiting contacts is critical to controlling the spread of the virus and ultimately in saving lives. If you're 65 years of age or older or have conditions like diabetes, heart, or lung disease, you're at greater risk of becoming seriously ill from COVID-19 infections. So please stay well by staying home as much as possible, taking your prescribed medications, and wash your hands often and practice good hygiene. If you can't stay home because of work or to meet essential needs, please consider protecting yourself by wearing a mask. And this is especially important, again, for those with chronic health conditions. For the latest information, please visit our webpage at dhec.sc.gov/COVID-19. Thank you.
Thank you, Doctor. Frank Alsheimer from the National Weather Service. Please, sir.
Thank you, Governor. Just wanted to give a brief update on the survey process for this historic tornado outbreak that we just went through. So far, as of mid-afternoon, we've had 16 tornadoes across the state of South Carolina, and 5 of those have been EF3 or stronger on the enhanced fajita scale. We have not seen that many strong tornadoes since 1984, so that gives you an idea of how rare this is. We, of course, unfortunately have had 9 fatalities, which is also the most we've had since the 1984 outbreak for a single tornado outbreak. I know that it's been a little slow getting all the information to you. We still have folks out in the field because of the vast expanse of area that we have to cover. So the number of tornadoes and the number of EF3 tornadoes may still go up over the coming days as we complete that. And please remember, we are still in the peak of our severe weather season, so to continue to review your action plans in case severe weather strikes. Thank you.
Director Stinson.
Thank you, sir. Yeah, Kim Stinson from State Emergency Management. I'm going to provide an update regarding the tornado outbreak that was occurred on Monday on the 13th. Damage assessments continue. As Frank mentioned, covered a fairly large area, but the hardest hit areas include Aiken, Berkeley, Colleton, Greenville, Hampton, Marion, Marlboro, Oconee, Orangeburg, and Pickens counties, all of which reported multiple homes damaged or destroyed. So the statewide residential damages right now are 1,147 homes in 21 counties sustained some sort of damage, and that includes 199 homes with major damage and 198 homes that were destroyed. In particular, Hampton and Oconee counties suffered significant losses. Oconee with 221 homes destroyed or with major damage, and then Hampton with 82 homes destroyed or with major damage. Current estimates in terms of the infrastructure damage, and that would include debris removal and emergency protective measures, is right now around 10 million, and it's probably going to be more than that. Our peak power outage was at 290,000, and that's currently, last I looked, was right around 1,400 earlier this afternoon. So that's a considerable drop, obviously, since Monday. And then DOT reported over 2,500 trees earlier, blocking 100 roads, but most of them, 99.5%, have been opened. Debris clearance will be completed for most counties next week, but for those hardest hit counties, it'll probably take 2 to 3 weeks to clear all the debris, and that includes Colleton, Oconee, Hampton, and Pickens. And some of the state and voluntary agency assistance to date includes search and rescue support to the local level, debris clearance, damage assessments, law enforcement and security support, building inspections, and sheltering. Working closely with the local authorities and FEMA to determine if the current estimated damages will result in any kind of federal assistance, and that could come in the form of a major federal declaration or a small business administration declaration. Residents can help with the state and local emergency managers determining the scope of this particular event. Anybody who sustained damage could report that damage in the damage assessment tool in our South Carolina Emergency Manager mobile app. That's got to go to the tools section, and that'll allow you to do that, to include taking a picture and sending that up to us. Also like to mention too that we've activated the donated goods system for COVID-19, similar to what we've done before in hurricanes and floods, and certainly looking right now in particular for personal protective equipment that could be donated to safeguard healthcare professionals and first responders, and that includes gloves, gowns, face shields, N95, respirator masks, and hand sanitizer. And you can either go to our website at scemd.org and follow the links there, or you can just call 803-737-8518 if you have a donation. And then last point, just want to mention is our website does in fact have lots of good information to keep you connected. It's sort of the central clearinghouse during emergencies. It's got plenty of links in there. You can get a lot of questions answered, or it'll tell you where you need to go to get those questions answered. And again, that's at scemd.org, scemd.org. Thank you, sir.
Thank you. Bobby.